We will talk about neurosis and anxiety disorder. When we say neurosis, usually we mean anxiety disorder, sometimes depression, but most commonly anxiety disorder. Now let's say, what is anxiety disorder? It is excessive worrying and excessive fear which interferes person's daily life importantly. It decreases quality of life importantly, and such people are worrying about almost everything, about health, about finances, about relationships. And symptoms include irritability, restlessness, fatigue, tension, muscle ache, weakness, and sometimes panic attacks. Now let's say how it happens and what are the main players here. Most important part of anxiety disorder is amygdala. Amygdala is part of our brain and it's responsible on emotions and especially on fear. And hyperactivity of amygdala causes intense fear and it sends false alarm signals in non-threatening situation, and person is overwhelmed, person feels fear in safe situations, and even everything is normal, person is oversensitive. It looks like very sensitive car alarm system. It should protect car, but if it's very sensitive and even touch the car and it starts alarming and it causes unnecessary noise and it's disturbing constantly, instead of protection it becomes problem. And it is same in case of anxiety. Our threatening system, our emotional system, our amygdala becomes problem because of hypersensitivity. And another example how anxiety affects us is, you can imagine person with invisible burden on it and he keeps everywhere this burden, and for such people everything is difficult, every decision is difficult, they always feel tired because of this burden, which is imaginary burden, it's not real, but they still always carry this burden with them, so everything for them is much difficult. And neurotransmitters are very important. Neurotransmitters, this balance is very important part of anxiety, especially low GABA. GABA is calming neurotransmitter, and low level of GABA causes anxiety, it causes fear. Noradrenaline and adrenaline play also important role, which means when they are high, it's high stress situation, and person feels increased heartbeat, person feels restlessness, he feels muscle tension, and serotonin level is low at this case. Serotonin is also calming neurotransmitter, and when serotonin is low, person feels depressed and irritable. And what happens during anxiety disorder? In many cases there is panic attacks. What means panic attacks? It's very intensive fear, it's misfiring fear center, and fight or flight reaction is started at this case, and person feels rapid heart rhythm, person feels shortness of breath, he feels sense of feeling of catastrophe and dizziness. It's panic attack. Panic attack looks like heart attack, and for people it's very difficult. And we can say that for anxiety, panic attack can be symptom, and panic attack can be subtype of anxiety disorder independently. It means that all panic attacks are part of anxiety, but not all anxiety causes panic attack. Panic attack is individual symptom and manifestation of anxiety, which happens sometimes, not always. Now let's say about causes. Most common cause of anxiety is genetics, and traumas, previous traumas is very important. Childhood traumas or loss of loved one or illness or loss of job or different traumatic events are important. They can cause anxiety disorder. Usually, person has past important traumatic event, and after this event, person has anxiety disorder. What is the treatment of anxiety disorder? First and most effective treatment is cognitive behavioral therapy. What means cognitive behavioral therapy? The main idea of cognitive behavioral therapy is that our thoughts, our feelings, and our habits are interconnected. So our thoughts, our feelings, and our habits, action are interconnected, and changing one causes changing others. It means changing our thoughts will change our feelings, it will change our behavior. So they are interconnected. And the idea of cognitive behavioral therapy is to change malfunction ideas, malfunction thoughts. First, you should identify them and you should replace them with healthy ones. You can imagine it like garden. In garden, you have healthy plants, but if there is weed, this weed inhibit growth of healthy plants, and it damage healthy plants, and it damage your garden eventually. So you need to find weed first, and you should call them what they are. They are weeds, and you need to replace them with healthy plants, and you will survive your garden. That's the idea of cognitive behavioral therapy. You should find these problematic thoughts, you should find these negative thoughts, and you should change, replace them healthy ones. For example, if musician worries about making mistake during performance, and he says, I will mess up and everyone will judge me, it's problematic, it's negative thought. And at this case, solution is to replace this thought with everyone is here to enjoy the music, and small mistakes, it's okay, it's part of live performance. So you can replace this malfunction idea and thought with healthy ideas and thoughts, and will change how you feel, and it will change your behavior. It's very important. Another effective part of treatment is antidepressant, especially selective serotonin reuptake inhibitors such as escitalopram or sertraline. They are effective. They are used for several months usually. They are considered also safe in many cases. And from supplements, from calming supplements, magnesium is very important. L-theanine is effective also. Ashwagandha has some effectiveness. Green tea also, chamomile extract, and valerian root extract also. They have some studies. These studies are controversial. They are not 100% effective, but they are still importantly effective in many cases. Another treatment method is exercise at least 30 minutes per day. It importantly reduces stress, importantly improves symptoms of anxiety, and mindfulness breathing is important part of treatment. It means you should inhale slowly for 4 seconds. You should keep your breath at 4 seconds. You should exhale slowly 4 seconds, and you should keep this position after exhalation 4 seconds and repeat. It is the simplest but very effective method of managing stress, and you can imagine that you are drawing square with your breathing. It means you inhale 4 seconds, you stop breathing 4 seconds, exhale 4 seconds, and you stop breathing then 4 seconds again, and then repeat. And it's imaginary square you are drawing with your breathing technique. It's effective because it activates your parasympathetic nervous system, and this parasympathetic nervous system causes calming. It has relaxation effect on your body. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.